subscribe now and press the bell icon. Never miss an update.
Hello and welcome to Health Live at Seniors today. We are delighted to have here with us Dr. Sujit Jagtap. Dr. Jagtap is an MD and a DM in Neurology with a fellowship in Epilepsy and a board certified consultant in sleep medicine. He is going to speak with us today about epilepsy, seizures, and other neuro concerns in senior citizens. A little about Dr. Jagtap. He is, as I mentioned, a consultant neurologist and an epileptologist. He's attached to the Bajaj Allianz Center for Comprehensive Epilepsy Care at the Deenanath Mangeshkar Hospital in Pune. He is a recipient of the Ian-Aina and the San Servo Epilepsy Fellowships. He bagged the first prize for the best paper on epilepsy at the National Conference of Indian Academy of Neurology and has over 50 publications in national and international journals to his credit. He has done over 600 epilepsy surgeries. Welcome to Health Live at Seniors today, Dr. Jagtap. How are you?
Thank you. I'm good.
Or should I say, Kasakai, since you are from Pune?
Yes.
Pune has some amazing medical facilities, but if I remember right, you are perhaps only the second doctor whom we've invited from Pune. So, but just before this session, I was speaking to Dr. Jagtap, and he was mentioning that this, and I was asking him about this Bajaj Allianz Center for Epilepsy, and he was mentioning that this center is perhaps the only one in Western India, and there's nothing like this even in Mumbai, and there are just very few centers, exclusive centers for epilepsy patients across the country. So why is that so, Dr. Jagtap?
Because epilepsy center requires a teamwork. It requires a dedicated team and lot of equipments which are very costly. So prescribing medications is very easy that everyone can do, but correct diagnosis and treatment requires dedicated team and equipments. That's why we are very few centers all over the India.
But doctor, I'm sorry to push you on this, but
yes.
Medical treatment is supposed to be teamwork, and
yes.
equipment is always very expensive.
yes.
Whether it's dental equipment or anything else. So is this the kind of infrastructure you need for epilepsy even more expensive than the regular ones?
Yes, basically it requires, it is like what epilepsy care unit we have. It is like 24-hour continuous run, and it requires dedicated team and not only one specialty doctor. Like I am epileptologist, then we require dedicated epilepsy surgeon, epilepsy nurse, then we require technicians, then we require neuropsychologists, psychiatrists. So all these work together in a single patient. Like if I'm seeing a single epilepsy patient, I will evaluate and I will prescribe medicine. So it is like my patient. But once if I want to do is a complete evaluation, then all team members come into the play. That's why very few units are there, because every hospital there is one person is available, other person is not available. So that's why I said it is a teamwork.
So I'm sure there'll be a question like this asked, but so where are the facilities in India available? Where are they available?
Yes. So if you ask me, like dedicated epilepsy care centers, like Western Maharashtra, we are the only one. If we go to the Mumbai we have it at the KM Hospital and Kokiraben Hospital, dedicated one. Then if you go to the Delhi, it is AIIMS Delhi, and then there is a Medanta Medicity, and now Faridabad new hospital has come. AIIMS Kochi has brought that, Amruta. So that is there. And then in Trivandrum, Sri Chitra is there. And then Kochi, there is Amruta Institute. So these are the big hospitals which are dedicated setup, like which we have. Not we have like a 10-bedded setup. Similarly, which is there in the Amruta Kochi, then Sri Chitra Trivandrum and AIIMS. Otherwise, everywhere there is 1 or 2 bed, because it is a time-consuming and equipment-oriented, and continuous monitoring is required.
And nothing in Eastern India, And you, as you said, in Western India also, there is just what you have in Pune as 10 beds,
Yes.
in Kokilaben 2, in KEM 1 or 2.
Yes.
So which means that's a very sorry state of affairs.
Yes, because this is really, because now where I have trained at Sri Chitra, from there people like me are coming out and they are starting the centers. So when we started our practice, there were hardly 6 or 7 centers. Now if we take like 1 or 2 beds, then in Gujarat there are 4 or 5 centers only. Not like we have 10 bed like that, but they are doing work. So there are 4 or 5 centers. Then if we go to the Rajasthan, I don't think there is a dedicated video unit in Rajasthan, not in MP, not in Bihar. If you go to the Uttar Pradesh, there I don't know. No, there is not a facility like this. If we go to the Delhi government institutes like AIIMS, it has. Then few private hospitals. When you go to the Punjab, only PGI Chandigarh also have, but it is not much. There are enough of other work. So this is not dedicated like this is there. Though there is a PGI Chandigarh, it is there. Then Ludhiana, there is 1 center. So there are very sparse centers. In Bangalore, we have at Nimans. Then few other private hospitals, 3 or 4 they have. Then if you go down in the Tamil Nadu, in the Chennai, there are 2 centers. So I can just count down the number of the centers.
So tell me something. In terms of statistics, has the number of epilepsy patients and people suffering from epilepsy, has that been declining, or is it the same, or has it increased? What are the stats like? I'm sorry, we as it happened, it was World Epilepsy Day on the 17th. And which is why we thought it would be good to have you over and to talk about this. And this is something which doesn't just affect people at a young age, but it also affects people at an older age. And which is why we thought it would be interesting. So, so one question before we go to your presentation: has the numbers increased? Have the numbers increased?
The numbers are usually what we say: 1 in 100, 1 person in 100 people will have epilepsy. Though as the lifespan is increasing, people in the elder age group are increasing, and they are going to have seizures. So we can't say the number is increasing exponentially, but it is going to increase as compared to the previously, because the lifespan previously was around 65 years. Now we are crossing 70 years. So as the age is going to go up, lifespan, we are going to see the more number of patients with epilepsy in elderly, and similarly we see high number of patients in the younger population also. As the our perinatal, like pregnancy care and newborn care is improving, that number is going little bit down, but this number is going to go up.
All right, doctor. So let me just request you to make a presentation on the subject which I just mentioned, which is he will be speaking on epilepsy, seizures, and other related neuro concerns in senior citizens. Those of you who have questions, as always, please put them in the Q&A tab, and we will then address it to Dr. Jagtap. You can mention your age, you can mention your gender. I do know that there are some social stigmas, etc., that are there with epilepsy. So if you do not want to reveal your name, you can just ask the question anonymously, and we will not even know who you are. Even the admin will not know who you are. So don't worry about it. Over to you, Dr. Jagtap. You can share your screen.
Yes. Thank you. I will first thank that senior citizens today that they have given me this opportunity. And as we are discussing, this is the Epilepsy Awareness Week, what we celebrate as, and 2 days back only we celebrated it. And then I'm going to present this epilepsy in elderly or in senior citizens. So what is the present state of affairs in India today about the epilepsy? As I was saying that we are having 1 in 100 person is having the seizures, and this video is courtesy of one of my colleagues who has provided me. So if you look at this, tell me what is happening. So what was happening here, this gentleman had something different in the house, and he is having this for last 1 year, once or twice a month, sometimes usually on the what we say Amavasya. So his wife thought that this is possessed by the ghost, and he's not other than any other city in the interior of the India. He is from the Mumbai. So what happened, this is the epilepsy is thought that it is not true epilepsy and is something as possessed. This is the misconception. That is the why I am showing this video, to say that this is the to increase the awareness. So if you go, what is elderly and what are the problems with the elderly? So elderly, the problems are that average lifespan is going to go on increase, and quality of life has improved. So defining elderly or senior citizen by age is arbitrary now, which was few years back. That is again going to move forward. So, and the elderly or senior citizen does not reflect the complexity of the age, health status, and the quality of life. So what we consider whether that person health of that person is having any other comorbidity, because as we know, by 40 or 50 years of age, you are going to start have some hypertension, some diabetes, or some other illnesses. So we classify elderly or senior citizens to 3 groups. One is young old, that is 65 to 74, then middle old 75 to 84, and then the oldest old, that is 85 above. Then we subclassify them into healthy with medical problems and the frail people. And why we are discussing epilepsy in this senior citizen group? Because as I was discussing previously, if you look at this graph, the number of the cases are higher during the first few years of life, especially in the newborn period. Then they go down, stabilize. Sorry. And as the age increases, if you look here, this graph goes up. So that's why we are concerned about the epilepsy or seizures in elderly. And by 2025, if you look, 30% of the population in the developing world is going to be above age of 60 years. So if you look here, it is going to be above age of the 60 years. That's why knowing about epilepsy in elderly is important. So what is epilepsy and what is difference between a fits, seizure and epilepsy? So epilepsy, fits or seizure or convulsion, mirgi, akdi, all are the same things, which synonyms or indicate the same thing. So what happens? There is abnormal excessive discharge in your brain, and suddenly that person do an abnormal activity. That what we call as a fit or a convulsion. When somebody have 2 or more seizures 24 hours apart without any provocating illness, like without any head injury, so his sodium is normal, his blood sugars are normal, then we call it as epilepsy, or he does not have any infection. So somebody is having 2 or more seizures, then we call it as a unprovoked seizures 24 hours apart, then we call it as epilepsy. When somebody has only one part of the body is involved, like one hand, one leg, or he looks to one side, then we call it as a focal. When to start with, when both hands or legs are involved, it does like this, or there is both eyes goes up, then we call it as a generalized seizure. And when we don't know from where it is starting, whether it started one side or when both sides together, then we'll call it as an unknown seizure type. So as per our brain, which part of the brain is involved, the person behaves like that. So this is the motor cortex from where our hands, leg and face area is there. So if somebody has involvement of this part, then the face goes to one side, his hand shakes or his leg shakes. When somebody is involves this blue color part, then what happens? He will develop some paresthesia or some tingling, numbness. So what we call it is a parietal lobe seizure. Somebody who starts the seizure in this area, it is really called as a temporal lobe. They have some auditory aura, they some hear something, the ringing in the ear, or they fear, or they feel, they see some previous old images or other things. When it starts in the occipital lobe, from wherever we are able to see, then they will have some blackening in front of the eyes. So depending on which part of the brain is involved, will manifest with the seizure. So what are the causes of seizures? Either because of brain injury, like there may be brain tumor, there may be the stroke, there may be the head trauma, or there may be the injury during the delivery that may cause your brain injury, which can lead to seizure. Sometimes infection of the brain, what we call as meningitis, can lead to the seizure. Sometimes some antibiotics also can cause seizure, and sometimes your liver failure, kidney failure, or electrolyte abnormalities like increase in the sodium or decrease in the sodium also can cause electrolyte disturbances and seizures. So how this differ from the younger population? Usually young people have some chewing like movements, some post-ictal confusion which is very less, but elderly they don't suddenly manifest with the motor features. Then there is a prolonged post-ictal confusion, and in elderly generalized seizures are less common. So it is very difficult to understand what it is. So, and in addition to that, whether it is a true seizure or a seizure mimic, like that it is, though it looks like seizure, it may not be seizure. These things are more common in the elderly. So what are the differential diagnoses which can be mistaken for the epilepsy, or epilepsy can be mistaken for these things, are like non-epileptic events, which are what we call as physiological spell, where somebody with the abnormal sensation or some lot of stress, they just stare like this and don't behave properly. So it can be mistaken as a seizure. Then syncope, where there is a transient loss of consciousness, or somebody coughs and falls down, somebody goes further passing the urine and then he faints, that we call as a micturition syncope. So that is possible. Then there will be transient ischemic attack, where for few seconds or few minutes there will be decreased blood supply to your brain, and suddenly you will develop weakness. So that is also can be mistaken. Then sometimes panic attacks can come like that. Sometimes sleep disorder also can be mistaken for the epilepsy. So how will differentiate? Most important thing in elderly is whether it is syncope or whether it is seizure. So when seizure can happen in any position, usually supine position, sitting position, lying down position. When syncope is there, it happens only in the standing position. It happens with when there is a significant stress is there, or when somebody does Valsalva maneuver, or somebody coughs. Seizures are rarely associated with nausea and sweating. Syncope is more associated with the sweating and nausea. Aura, that is the premonitory symptoms. Which are uncommonly or not seen in the syncope, are commonly seen in the seizures. In the seizures, symptoms are usually unilateral. That's why I was saying focal. But in syncope, they are usually bilateral. Then the person can become pale during a syncope. He may develop cyanosis in a syncope. Loss of consciousness is brief in a syncope, while it is more in the seizure. Then movements, usually some brief jerks like this can happen in the syncope, while seizure, like the first video I show, or I am going to show few videos, these are the prolonged movements which happen. Tongue bite is rare in seizure, syncope, more commonly seen in the seizure. Then the salivation is rare in the syncope, more common in the seizure. In addition, EEG is mostly normal in syncope, but it is abnormal in the seizure. Then I said previously also, the confusion is more common in the seizure post-ictally, while it is uncommon during the syncope. So as I said, there can be provocative seizures like electrolyte disturbances, hypoglycemia, or sometimes medication or toxic, especially somebody is taking regularly alcohol and suddenly stops alcohol, he may develop seizures. And other differentials which are very commonly seen, these syncope, TIA, TGA, there is transient global amnesia, panic attacks, which are can be seen commonly in the elderly. So if you look at this video, so he was a 70-year gentleman who was referred me for a seizure or epilepsy. But as you saw earlier, he had just he sat in the bed. He had a cough and then he falls down. So what we call this is a cough syncope. Because of the coughing, there is a syncope, and because of which he developed a seizure. And if you see, immediately regain the consciousness. So this is what we call as a cough syncope. And in many times this can be mistaken for the seizure, and then the patient takes long-term treatment. When if you look at this lady, she is a 70-year lady who came with the memory impairment and seizures. Her hand goes like this, face becomes like this. She keeps hands like this, and recovers. So these are very brief seizures. What these are the focal seizures, and she had something different thing was completely reversible and may not require long-term anti-epileptic or anti-seizure medication. Now this lady, she has continuous, as I said previously, this right hand and leg movement. So many times this can be mistaken as a seizure or a non-epileptic event. But this she had because her blood sugar level was sky high, they went above 500, and then she started having this movement. So this is not a seizure, but this is a seizure mimic. So as I said earlier, the clinical presentation can be like a memory impairment or memory issues. So like a transient epileptic amnesia, which usually happens after 55 years of age. It can be repetitive, last for minutes to hours, and it is a pharmacosensitive form of mesial temporal lobe epilepsy. And why knowing about the seizures and epilepsy in elderly is important? Because there is a high recurrence rate, about 25 to 50% in general population. Then the data in elderly is lacking, and it is reasonable to start a seizure drug after the first clear seizure. But before that, we should do a proper diagnosis. And why the management is important and difficult in elderly? Because if we look in the adult, the therapeutic window is high, while in elderly, as the age increases, it goes on decreasing, because there will be pharmacokinetic variability, like there will be change in the absorption rate of a drug. Then your liver function is going to go down, your renal function or kidney function is going to go down. So we have to you have to choose the drug properly, we have to choose the dose properly. In addition, that person will be on other medications for maybe his diabetes, for his hypertension. So that all other comorbidities we have to take into account before starting a treatment in elderly or senior citizen. So that is the importance. So there are a big list of the drugs which we are going to use in the epilepsy, but for adults we use fairly 3 or 4 drugs with also caution, because we don't want any interaction with the other medications, we don't want interaction with the other drugs, we don't want to affect their liver function, their kidney function, and we don't want any side effect like dizziness or excessive sleepiness as well as cognitive decline, because these drugs can have these side effects. So managing a person with epilepsy in a young age as compared to a senior citizen is difficult and a little bit challenging, because we have to take care of other possibilities also. So to conclude, the high incidence of new onset epilepsy is going to have in elderly than any age group. Most common etiology is a stroke, because as the age increases, there will be stroke. So one part of the brain is going to get a little bit affected, and which is going to may cause seizures. And there is a high risk of recurrence after initial seizures. So that's why if it is a clear-cut seizure, we will start the drugs. And we have very few drugs as compared to the young population, which we can use widely in the elderly population. Thank you.
Thank you very much, Dr. Jagtap. Thank you very much for a very detailed presentation. I must confess, there were some parts of the video which I couldn't watch. It was just too stark, but I guess it just gave an indicator of what things are and how serious and real the problem is. Doctor, we have a few questions, not too many of them, but a few of them.
Yes.
The first one is a very basic one. Is there a permanent cure for this disease?
Okay, so there are various different reasons for epilepsy as the age criteria. There are some age-related disorders, but in elderly, what we think, rather than cure, now we want a control of the disease. So if somebody has a epilepsy or seizures, we start them on the drugs, and we see for 1.5 to 2 years, and then we reduce and stop the drugs. And cure, if you ask me cure, if in elderly, we don't have cure for the epilepsy, but we have drugs for epilepsy.
So there are drugs for epilepsy. We have another question from an anonymous attendee. Can there be a memory loss after seizure? If yes, is it reversible?
Yes, there is a memory loss of the after the seizure, and what we can have that is a transient episodic loss of memory. So during that period, what happened, you don't remember, and then for a half to 1 hour, we may have a confusion. But after that, we remember everything what was there before onset of seizure and after the seizure. So it is a reversible.
It is reversible. That's Doctor, we have another question, which is, do all essential tremors get converted in Parkinson's? I'm on Prolet 2525 twice a day. It has made my brain work slowly and foggy, and there is confusion. Is there any alternative? Do alternative therapies work?
Yes, essential tremor, all essential tremor does not convert into Parkinson's disease. Some can be, Parkinson's disease can be mistaken for the essential tremor. Somebody who is having essential tremor means they have only tremors. They don't have any slowness of activity or any other problem. And usually they require a treatment when it is going to affect your quality of life. Now you say you are on Prolet. So Prolet causes sedation, it causes clogginess also, that is true. We have other drugs, but usually the people who had essential tremors, their handwriting gets affected and they have difficulty drinking water or tea. So we can have mugs with the 2 handles, so you can drink with that. So you have to do adaptations if you don't want to take the drug, because in the essential tremor, if you are going to take a drug, then that drug is going to act for a definite period of time. After that, again you have to take the drug. So it is not a cure. So if those tremors are not affecting your quality of life, then you don't require tablet. Then beyond the Prolet, we have other tablets, and if their tremors are definitely affecting you too much and you don't want to take the drugs, then we have newer therapies also, like what we can call as a deep brain stimulation, where we place electrodes in the brain and control the tremor. Like a pacemaker which control your heart rate, we control your tremors from putting a wire in your brain. But again, that comes with the implant. So if somebody is younger, 50 years, affecting everything, or somebody is 60 years and who wants that get rid of the tremors, then we can consider deep brain stimulation, what we call as DBS.
Right. Doctor, you spoke about medication, medicines. We have a question from Meeta Bhavsar, who asks, are there any side effects of seizure medication?
Yes, there are few side effects depending on the dose of the drug. Each drug has different side effects. So the person who is going to treat you, they will mention you about the side effects. mostly what happens with the initially at the start of the medicines, you may get sometimes dizziness, then sleepiness, but as the duration of treatment goes on, like after 1 week, you start doesn't feel those side effects, and these go away. Few drugs will change in your meditation also, change in your behavior or mood also. So immediately you have to go back to your physician and you have to tell them. So each drug has some different type of side effects, but there is no such drug that which does not have side effect, but usually it is dose related.
Thank you, doctor. There was a slight technical hitch which was there, but now it's all right. Doctor, we have a couple of questions from Mr. Suresh Vengankar,
Yes.
who asks, if you have mental illness and symptoms of epilepsy, who does one contact, a psychiatrist or a neurologist? And he asks another question. Also, can you specify the role of the psychiatrist and neurologist?
Yes, very good. So treatment of epilepsy is predominantly done by the neurologist, and if there are associated behavioral issues, psychiatric issues are there, they are going to manage by the psychiatrist. So that's why I said initially also it is a teamwork. Then now India, there are less number of psychiatrists, neurologists are available. So many times psychiatrists also treating epilepsy. So, and 1/3 of the patients with epilepsy, they also have behavioral issues or psychiatric issues. So that we have to recognize them and we have to address them appropriately. Like somebody with epilepsy, they can have depression, they can have anxiety, especially women with epilepsy, they have anxiety, whether my child is going to have this disease, whether because of my medicines, the baby is going to get affected or not, then they may go in depression also. So all these things go hand in hand. Nearly 30% patients may have behavioral issues or psychiatric issues during epilepsy. So that's why I said epilepsy and comorbidities, where we require a teamwork with the psychiatrist, and depending on that, we can modify the drug. Some drugs like levetiracetam, which is a newer drug which causes behavioral issues. So we call patients up to 2 or 4 weeks and ask them, is there any effect of the drug is there? Is your mood has changed? Because some people tell that I have become so mad that I can't handle this drug. Then we change the drug. Other anti-epileptic drugs like carbamazepine, sodium valproate, these are mood stabilizing drugs. So many times psychiatrists use these drugs not only for epilepsy, but persons who are having mood disorder.
Right. Thank you, doctor. Is helpful for a patient? Meeta Bhavkar asks, is meditation helpful?
Yes, definitely. Meditation is helpful not only for epilepsy, for other things also, to reduce the anxiety and improve your quality of life, improve your memory. So meditation is definitely helpful.
Right. We have Mr. Lakshminarayan from Bengaluru who asks, the medicines given for an epileptic patient are sleep-inducing and makes an individual dull. My cousin, from being an active person, has become dull. Is there a view?
Yeah, so I said it is very difficult. It is like very balancing act when it comes to the elderly. So we have to change the dose of the drug. If it is we have to see how frequently the seizures are coming, how is the control of their epilepsy. You can ask your treating physician or neurologist to reduce the dose or change the drug also, because sometimes drugs can cause sedation also. So or you can, if you take them on empty stomach, their levels will rise. So take them after you take your lunch, your breakfast or your dinner, and maximum dose you can take during the night, so that they don't, if you take in the morning, it may make you sleepy or dizzy. So you can reduce the dose as per the with your consultation with the physician or neurologist.
Right. Thank you. Doctor, we have a question from Mr. Santa Maria who asks, what is the difference between clonic and tonic?
Okay, so tonic is like this. So you just, there is increase in the tone in your body and your hands become stiff. While chronic, as I showed that one of the video with the cup syncope, there is a jerking like this. So there is a repeated jerking like this. So what we call this as a clonic.
Right. We have a few more questions. Who's Meeta Bhavsar. Yeah. So she says, I'm getting seizure at night only in sleep. Why is it so?
Excellent question. So what the people who have seizures in the night, what we call them as a nocturnal frontal lobe epilepsy, because some patients usually have seizures in the night, and there is a synchronization during the sleep. There is activation of your interictal discharges, or what we call as the abnormal synchronization in your brain, and which cause them having a seizures. So it can be genetic cause, or it can be related to some abnormality in the brain. So what we call it as a nocturnal frontal lobe epilepsy. So these people, most of the time, nearly more than 90% of the time, they have seizure in the sleep.
Right. There's another question which is there is, does epilepsy have a direct relevance with diabetes?
No, epilepsy does not have any direct relevance with diabetes. The video which I showed, that person does not have epilepsy, but it was thought that he had a seizure. But that happened because there was increased sugar and there was some swelling in the brain. It disappeared once the sugars were controlled.
Right. Doctor, there's a question which is a little different, which is, would like to know if restless legs is related to disturbed sleep? What is your advice?
Yes, restless leg, they cause disturbed sleep, and the restless leg syndrome happens especially those who have vitamin B12 deficiency, who have iron deficiency anemia, who has diabetes. Okay, so and poorly controlled sugars. So all these things you need to rule out, and rarely it can be idiopathic. So you need a complete evaluation and treatment for restless leg syndrome.
Doctor, the other question is, Mr. Lakshmi again, he says his brother also goes blank and falls on his head facing the ceiling, not sure if it is due to something else.
No, the falls, as I said previously, falls are common in epilepsy, especially like frontal lobe epilepsy. We have falls common in epilepsy, and you can have fall forward or fall backward also. So that doesn't differentiate it from a syncope. So if the person has a salivation, has a tongue bite, has a prolonged post-ictal confusion, prolonged loss of consciousness, then it is a seizure. When somebody has this happens in the standing position associated with the sweating, then there is a immediate recovery from that episode, then it becomes a syncope.
Right. One last question, doctor, is can we have your contact number and clinic address? What we'll do is we'll put doctor's clinic address with the takeaways. Every session of ours, we archive it and we edit this video, and we'll put this video as well along with the takeaways, and that can be there, will carry your details. But just for your information, Dr. Jagtap is available at his own clinic in Pune, as well as the Deenanath Mangeshkar Hospital, which has the Bajaj Allianz Center for Epilepsy. So he's available at both places, and he can be reached there. As far as the clinic address is concerned, can I just give it? Can we give it to our people right away so that they don't have to wait till?
Yes, it is the 303 Mangal Murthy Complex, Hirabag Chowk, Tilak Road.
303 Mangal Murthy Complex,
Hirabag Chowk, Tilak Road.
Hiremath Chowk, Tilak Road.
Hirabag Chowk, Tilak Road.
Tilak Road, Pune.
Yeah.
Pune 1.
This is a 411009.
411009. That's there. Doctor, there are a few more questions that have come in, if you don't mind.
Yeah, no problem. Yeah.
So this is Meeta Bhavsar again, who spoke about seizures of the night while sleeping. What should be done immediately at the time of seizure?
Yeah, very good question. Actually, I forgot. Like that, we have a midazolam spray now available, which we have. It is a nasal spray for the asthma. We take spray on the mouth, in the mouth. For epilepsy, we have midazolam spray, which have to put spray into our nose. 5 puffs in the right nostril, 5 puffs in the left nostril. So that will reduce or stop your seizure. Don't put your fingers or anything, towel or spoon into the mouth. Make that person to one side. If his collar is tight or other tight garment is using, make it loose. And if the froth or saliva is coming, let it come down. Don't push or don't try to wipe it out. The 90% seizures stop in 1 minute. If any seizure lasts longer than 5 minutes, you have to immediately rush that patient to the hospital. But as I said, 90% will stop in 1 minute and rest nearly stop within 2 to 3 minutes. But during that period, each second looks like a minute. So we'd say that 10 minutes, 15 minutes. But that person goes into post-ictal confusion, which may last for 15 to 20 minutes. So don't get panic. If somebody develops 2 seizures in 30 minutes, rush him to hospital. If somebody develops a seizure which lasts more than 5 minutes, rush him to the hospital. If you have spray available at home, then you can use that spray or just wait, that seizure will go away. Don't be panic, don't put mouth, don't give anything in his hand, don't give him water, or some people use their chappals or shoes and make them to smell. Don't do like that. Don't do anything, any other heroic thing.
Doctor, but which hospital can one take a seizure patient to? Somebody who requires the hospitalization, because as you said, there aren't too many hospitals which are into treating seizure and epilepsy patients.
No, you have to take to nearest hospital, because we have, like I said, midazolam spray, that injectable drugs are available. So you can take to nearby hospital for immediate treatment of a seizure.
Right. Thank you. There is one more question, which is cervicogenic headache a neurological problem? I have a problem with C5 and C6, which is causing ache from the buccal cavity upwards and down in the shoulder.
Okay, cervicogenic headache, a neurological problem. So yes, it is a neurological problem, and cervicogenic headache, again, many times many people feel that they have spondylitis or they have any different things. But if it is a headache, then it is a part of the migraine, and predominantly it is related to the lifestyle. So we have to do the lifestyle modification. That is will suffice. If it is very frequent, then it requires medication.
Right. Thank you. And I think the last question which was there, you've already answered. Is there a cure, or one has to live with it? You have already answered that. Thank you very much, Dr. Jagtap, for being here. In these last 40 odd minutes, we've answered quite a few questions. You've given a very detailed presentation. This is the first time we've had somebody speak about epilepsy and seizures. And it is, while it was a great presentation, etc., it is a little worrying that we don't have really too many medical units available across the country for this. And I hope this is reversed and it increases. Before we go further, I have a couple of small announcements to make. As you know, we also conduct Seniors Have Talent, which has started it is in its Group B. Those of you who want to attend all our health webinars and do not want to miss it, there are times when we announce these health webinars a little late. So those of you who want to attend these webinars and do not want to miss out on an announcement, please register. We have a pre-registration link which you can fill in, and we will register you for every Saturday. As you know, you can mark the time. We are always there on Saturday at 5 p.m. For a session. I know it's a tricky thing. As we can see, Dr. Jagtap is a his clinic, and I'm sure there are patients waiting for him. It's a Saturday evening. It's post-lockdown, and so there are people who want to visit the doctors on a Saturday evening. So, but be that as it may, so those of you who would like to can, the pre-registration link for our health webinars has been put on the chat window. You can please register and attend that. That apart, last week we announced a calendar of various events that we have, and I'm going to ask the producer to do two things. One is to put up the calendar of the events for a second, and I will just go through them. Doctor, I must also take your attention for this, and you will also perhaps you could recommend to your senior citizen patients, etc., contacts or what they are. Dimple, can you put them up? Can you put up that creative? So we have sessions every day, Monday through Saturday, and this is what it is. So I'll just take you through this. On Monday, there's a dance session by Feroz. Now this is all for 60 pluses only. We don't take even somebody who's 59 and 11 months. So there's a dance session by Feroz. There's in the evenings on Mondays, alternate evenings, we have a housey and little known stories by Mohan Krishnan. On Tuesdays, there's an open house by KV Lakshminarayan. Mr. Lakshminarayan just asked a question right now. He's in Bengaluru. Wednesdays, there's Zumba by Rani Nambiar, and in the evenings, there's Seniors Have Talent, which has gone through its 9th season, which is right now in its 9th season, and we have had over 1,000 participants in that, and they are all very good. A lot of people are there. In fact, many other people who are there who are conducting sessions here are all senior citizens. So, Nilofer Amnani, we can. What we'll also do is I'll ask the producer to put the WhatsApp group link on the chat, and you can just enter that and be part of the WhatsApp group, which is the events WhatsApp group, and you will get alerted. So on Thursdays, there's Antakshri with Usha Jacob and karaoke singing by G.D. Sharma. Both of these people were Seniors Have Talent participants. And then we have Anita Rakshat, who's doing on Fridays meditation and yoga. And on alternate evenings, there's poetry and prose by Sajni Vaidya. Then there's on Saturday mornings, acting classes by Mohan Krishnan. And in evenings, it is the health webinar. So, but for a few people over here, all the sessions are conducted by former Seniors Have Talent participants. So, that's a big community out there, which is there. I'm going to take one more minute of yours, Doctor. I'm going to request the producer to have to show the video for the November issue that has just been published on the 16th or the 15th of November. The latest issue of Seniors Today is there, and you can watch the video right now and get the highlights. So I don't think the music is there, so I'll just take you through it. The cover story is on Prithviraj Kapoor, and that has been written by the award-winning journalist Deepa Gehlot, and the legend lives on. Then there's an interesting article by Mr. Vikram Sethi on My Heart Goes Garden Garden, and there's Elementary. There's an article on sleep, which is by Dr. Nandini Saini, and there's an article about publishing yourself, Vanity Publishing, by Mr. R.V. Rajan. You can become a publisher yourself of books, and these are some tips by him. There's a travel article by Dinaz Wadia on Sikkim. So that's it. It's free of cost on Seniors Today, seniorstoday.in. You can go and read the magazine. You can also read the last 40 issues of the magazine. We started publishing in July 2019, pre-pandemic, and we have been publishing every month on the 15th of every month. I know I look like I'm doing a sales pitch, but one has been doing that over and over again, and one so enjoys this entire thing. So this is what we do, Dr. Jagtap, for seniors Today. We publish a magazine every month. We have a website which is there, which is updated daily, Monday through Saturday, and we also do these various programs every day. And the health webinar is what we started first in June 2019. And we've had over 125 doctors from across the country and who have been there. And these have been running for 2.5 years. So that's what we do. And we will be back next week on Saturday, the 26th. We have Dr. Patnaik, who's been there with us in the past, who's going to be talking about kidney stones. So that's a session which is there on next Saturday, the 26th at 5 p.m. And before that, I would like to thank Dr. Sujit Jagtap for being here, at the last minute. And thanks to Namita Shabad for having facilitated this. Thank you very much, Dr. Jagtap, for being here and for an excellent session. It is, of course, the questions that came in also show that the level of awareness is also very low. So I'm glad we did this, and I wonder why we didn't do it earlier. We should have done it much earlier, because this is concerning a lot of senior citizens. It's
Yes.
not that people may have been absolutely normal for their first 50, 60, 70 years, and they could suddenly develop seizures. So it's an important topic to consider. And I'm glad that the medical fraternity does observe a World Epilepsy Day on November 17th. And I'm really glad that I noticed it and we invited you for it. Thank you very much once again. Thank you.
Thank you for invitation. Yeah. Thank you. Yeah. Good day.
Subscribe now and press the bell icon. Never miss an update.